Welcome to Inside Maine Healthcare. I'm Joel Allenbaugh. Today we have David Lawler from Mobius Inc., Jim Meehan from Katahdin Friends, and Cullen Ryan from Community Housing of Maine talking about some of our most vulnerable population, folks with developmental and intellectual disabilities, and how they're cared for here in Maine. Stay with us. We'll be right back.
Inside Maine Healthcare is Maine's only show dedicated to healthcare in Maine, brought to you by the healthcare industry and business leaders. Inside Maine Healthcare will bring you the practical information you need to understand what is driving our healthcare costs and identify the resources available for you to better manage your own healthcare. Learn how healthcare reform, new laws, and policymakers impact Maine business and consumers. Find out what business can do to offer affordable, comprehensive healthcare. Join us as we discover and implement innovative solutions to Maine's complex healthcare challenges to provide Maine people more affordable, sustainable, results-driven healthcare.
Welcome back to Inside Maine Healthcare. Well, we've got a few of us here at the table, so I'm going to start with quick introductions. So to my left, David Lawler, Executive Director for Mobius. I'll let you give us a quick what Mobius is in just a few moments.
Sure.
To my right, Cullen Ryan, who's Executive Director for Community Housing of Maine. And then to my far right, Jim Meehan, who's Executive Director for Katahdin Friends. Or Katahdin Friends. Katahdin Friends. Maybe just a couple seconds of each of you to tell the audience what those organizations are. Maybe we'll start with you, Jim.
KFI is a nonprofit organization that assists people with disabilities in northern Penobscot County. Our headquarters are in Millinocket. We also have offices in Lincoln and Bangor. We started as a small community organization and over the last several years have become a regional organization that's won a couple of national awards for our efforts to help people be part of their community.
Interesting.
And Community Housing in Maine is a small nonprofit, and we go across the state, and we're actually the largest supportive housing provider. And supportive housing is a mixture of affordable housing with supports to allow vulnerable populations to be successful out in the community. And we work on community inclusion. We also do advocacy, and we have some workforce housing as well.
Great. And then David?
And Mobius is the primary provider in Lincoln County of services to persons with intellectual disabilities and autism, similar to Jim's agency. We started about 30 years ago as local residents were looking for an alternative to placement at the state institution at that time, which was Pineland.
So when you talk about these populations, we're talking about developmental and intellectual disabilities. So we're really talking about the most vulnerable, I would say, in our society. Jim, maybe you can give a little bit of history, because you mentioned Pineland, and I know there's been a change in sort of the care model, if you will, for that population.
Well, yes, if we go back into the 80s, our funding for provider organizations was primarily state grants, small amount of money, a lot of flexibility, and a real interest on the state's part in helping local organizations and parents in local communities form organizations to assist people with disabilities, as David said, to stay out of the institution. We moved into the 1990s, we really started to receive, provider organizations received more Medicaid dollars, and this was the seminal moment, I think, in the 90s was the closing of Pineland, the institution for people with intellectual disabilities. Personally, during that time, I just saw it as a natural progression. Now, as I look back upon it, I look at it as a huge, bold, brave move because there are still, I think, the majority of states, certainly a lot of states, that still have institutions. That stopped in the state of Maine in the early 90s, and so provider organizations, community organizations such as the ones Dave and I represent, started to absorb people who previously would have been in those state institutions. And sometimes I think that's an undervalued portion of the service delivery system in the state of Maine, that without that state institution, people are in the community and receiving services in their communities. And just to round out as we move forward, in the years of 2000s, I think we became much more reliant upon Medicaid dollars. And it became, just a few years ago, I think much more rigid, much more bureaucratized, if I can say it like that. So the rules and regulations really kind of make flexibility somewhat more difficult. I think that in terms of community inclusion, I think we've grown an awful lot since the early days. I think that we really are much more involved with helping people be parts of their community, to live, work, and to just access community resources as any other citizen would.
I've heard Medicaid a couple times, and we're in an environment where we're under a lot of pressure to reduce cost in Medicaid. You know, where do you see this impacting the populations that you serve?
Well, our organization, through its advocacy, has created something called the Maine Coalition for Housing and Quality Services, which is essentially a parent-led coalition of folks that are taking a look at the way that services are delivered around the state, and we've come up with some ideas that we think is the next progression in this move from deinstitutionalization to housing to really having folks with developmental and intellectual disabilities be truly a part of the community. And so what I think what I'm hearing from parents, and I am a parent of a child with developmental disability, what I'm hearing from other parents, what we really like to see is as close to a normal environment as possible, where our sons and daughters are really, as successes have happened with special education, where people are really a part of the school system, have that translate into where people are really a part of the communities in which they live, and really a functioning part of that. And so what we're trying to do is to have this seamless transition where folks will move from out of special education into young adulthood and do some of the same things that other young adults would do. Live with a group of peers, be able to have pizza together, watch movies, do the things that folks want to do, but also have the freedom and flexibility to walk across town, to take public transportation, and to get to places they need to get. And the way that the system has evolved has really worked towards risk aversion, to really avoiding people from getting hurt. As you can imagine, when you take responsibility for folks, you don't want them to get hurt. Nobody wants them to get hurt, but we also want to preserve the dignity of risk, to allow people to interact with their community in a way that feels normal, that is the way that everybody else would. And that involves some letting go a little bit. But then having the services come in when people need them, to take on the tasks that are a little bit beyond their capabilities, or to allow them just success and independence. So.
You're hitting a little bit close to home. My daughter, who's 14, reminded me the other day that she can get her driver's permit in September at her birthday, so I can appreciate the push and pull on giving flexibility and freedom. I'm hearing, when you talk about sort of integration of the community, and I you know that my wife is an RN and works with this population, has for really her whole career, so I have some perspective. Parent involvement is critical. How does that impact, I mean, I'm sure you see that in the populations that you serve. There's got to be a difference when there's, differing levels of involvement at the parent level.
Yeah, I can't speak of that any more eloquently than Colin has. But clearly, I think that, and we haven't talked about this kind of waiting list for services that's building up over time. It's getting up to around 800 individuals, probably unduplicated, something like that. And these are people that are waiting for resources to be available to get services. They're getting case management now, but nothing else. But I have to think that the largest portion of that group have families that are committed to staying involved as services do become available and people make the transition to independence and living more independently in the community. And that's an invaluable resource to the individuals on a personal level, and from the standpoint of cost, it's a tremendous resource, because without question, I think the largest portion of cost to support the folks we're talking about really gets dedicated to kind of routine supervision. And if you look at the home and community-based waiver, which is, these terms are kind of confusing to the general audience, but it's the primary funding source for people with higher needs who have intellectual disabilities in Maine. The majority of those people receive some form of 24/7 support right now. Some of us feel there's individuals in that group that can learn skills and become more independent and rely less on paid staff supports in addition to with family supports. And I think, Jim, both of our agencies have seen some successes in that area.
We're coming to the close of the first segment,
Sure.
but so I'm going to kind of pause this, but you're making some good points, and it'd be interesting when we come back. I know that there's also the integration into the job force, and I know you have some perspective on that, some experience with it I'd like to touch on, and also the whole point of people on a waiting list and the need to find more sort of creative and affordable ways to provide services to this population is obviously critical for sustainability in the long term. So maybe we can touch on that a bit. Thank you all for staying with us. We'll be right back.
Let's face it, Medicare plans can be complicated. That's why when someone finally gets it, it makes my day. When I hear that relief in their voice, I know I've done my job. I'm Samantha, and I'm proud to work for Martins Point Generations Advantage, the highest-rated Medicare Advantage plans in Maine for the last 2 years, according to Medicare.
More people joined a Martins Point Medicare plan than any other in the state last year. We've provided high-quality health care here in Maine for nearly 30 years. It's your health. That's the point. Martins Point.
Hi, I'm Denise Dumont-Bernier, the Director of Workplace Health. Do you want to work with a team of trusted occupational health specialists with many years of combined experience and proven results?
I would recommend Workplace Health because they have high-quality programs and people. They deliver what they promise, they care about our employees.
Do you want a healthier and more productive workforce?
CMALMI has reduced its workers' compensation premium by 60% in the last 3 years.
Our employee wellness program, which is run by Workplace Health, has kept our healthcare costs flat for over 3 years. This has saved millions of dollars for Maine General Health and all of our employees.
You will get timely appointments for your pre-placement or DOT physicals. You can expect direct contact with our doctors and nurses and emailed results immediately following care at our practices. Join hundreds of other businesses in the greater Kennebec Valley and call Workplace Health, a department of Maine General Medical Center, to be your partner in health.
Harvard Pilgrim is the only private health plan in America to achieve the #1 ranking for member satisfaction and healthcare quality for 8 years in a row. Healthcare is constantly evolving. We are not a company that remains stagnant. We're looking for ways to improve what we already have, to find solutions that bring about greater value. That's making healthcare work better, and at Harvard Pilgrim, we're working on that every day.
Welcome back to Inside Maine Healthcare. Well, just before the break, you touched on, I think, an important point, which is we have this waiting list for folks with intellectual developmental disabilities through the Maine Care program. Personally, the concept of that is troubling to me, that there's a waiting list at all for that particular population. But I think it speaks to the fact that we have got to identify more cost-effective and sort of creative ways to care for that population if we've got any hope of having the resources over the long term. And part of it is I think the community inclusion, as you talked about. There's also the inclusion to the workforce. And I know you have some specific experience with that. I wonder if you could share with us, Jim.
Well, the concept is called Employment First, and it began actually, I believe, in Washington State, and it really starts, and many states are involved with this, and I think the state of Maine is certainly taking a look at this. And the idea is that employment should be the first option, the first thing you think about when a young person leaves high school, as Colin was saying, or Dave, about the transition, into what? Into the workforce. I mean, what's the model for anyone? It's you go to work. And so Employment First puts the emphasis on assisting people to find jobs and to be a regular member of the community through work. And then adding other supports around that as necessary. And part of that, I think, is the idea that we want people not to be captured by the social service system as much as possible. And yeah, some people need lots of supports. One of the things we were talking about, a very diverse population here, all kinds of needs all over the place. But for a large number of people, work is the answer, not only in terms of value to the community, but also economic empowerment. You know, we all like to work because we get paid. Hopefully we have jobs we also enjoy. And that becomes then the model for people with disabilities, particularly those coming out of high school.
And what else, do you think the structures that you said Maine is starting to look at now, I mean, does Maine need to do something to facilitate that happening, or is it just a matter of individual service providers having that focus?
Well, I think the employment first perspective on things is a statewide initiative, which says we value employment first. So we're looking at services around employment. And you know, there are lots of ways we trip over each other in terms of making that a part of our regular service. And we want to eliminate those. We just want to make work as easy and as seamless as possible. There are also national provider organizations that have pushed employment first. And so it comes state to state from different directions. Sometimes it's a state entity, sometimes it's a university, and sometimes it's a provider group. But it really is an acknowledgement of a kind of a formalized approach to say, yeah, employment is so important that it's going to be the first thing we talk about.
Yeah, makes sense. What else do you see?
Just following up on the employment, you know, you're really looking for win-win-win situations. And so, you know, Jim spoke to the benefits for the individual working, which are multiple. And we're also looking for employment in community settings. And competitive employment is a reality. It's not something that's intangible for folks that we support. It's a reality. And we support at Mobius about 25 or 30 people in 20 or 25 different businesses in the communities. People may work a couple hours a week or full-time. It varies depending on individual interests and ability. And then over time, the people develop their own kind of support systems on the job as they do in the community, and that helps pick up some, I think, of that risk aversion issue that Colin talked about. People become part of the communities. We have many examples of how that has worked. And so, again, the paid supports, the support shifts from the paid supports.
Right.
Yeah.
And what else do you think needs to be done?
Well, I think we've got a disconnect right now between what we want to see happen out in the community and what's happening right now. And that you can see how it progressed. We had you know, a move from deinstitutionalization. We had systems that were set up to sort of house people in the community, but really protect them in the community. And as they realized that, geez, the cost trajectories are going up, they said we should limit this just to folks who are in really life-threatening situations to be able to be eligible for the waiver. And so, of course, what that's done is caused the cost to go even higher because you're serving people who are more profoundly disabled, but you're leaving a whole larger group of people who have less limitations in terms of their capabilities out of the system entirely. So folks are graduating from high school fully prepared to enter society and essentially fall off a cliff because there's nothing there to support them in being successful out in the community. So what I think needs to change is us to actually inject some resources to get this waiting list, which is close to 1,000 people and growing by 100 people every few months, to stop, so that we actually start serving people. But we find a new way to serve people, to just really just meet their needs exactly where they're at. And I think that parents want this, folks that have disabilities want this, and agencies want this, and DHHS wants this. But it's a matter of us actually moving the system now to say, okay, we're going to accept a little bit more risk. We're going to try out some of the things that we think make sense, like instead of having people overnight staffing for folks so that they can, we're sure they're safe overnight, we can take a look at some electronic monitoring and have one person keeping their eyes and being available, at a push of a button to respond to needs as they arise overnight, and instead put those services and resources that are saved by that into programming people during the day so that they can then launch from what they know and what they're braced for into the community. The converse of this, if we don't do this, what happens is folks like me, a parent, when my son in 4 years graduates from special education, either I or my wife are going to have to quit our jobs and really stay home to keep my son, from doing things that we don't, he shouldn't be doing. And that's a loss to our economy. It's a loss to, what I do, livelihood, that sort of thing. And certainly a loss to my son, because he will then be isolated at home and not able to take what he's learned and put it to use in the community, building relationships, interfacing with the community better and better. And we need to actually take this step, redesign how we deliver services so that they work better and serve people so that they can actually take advantage of all the natural supports that are out there in the community.
That makes a lot of sense to me, and I think one of the things that happens, Medicaid is joint funded, so it's state and federal dollars, and with it come immense strings. And structure. And I'm guessing that inflexibility makes some of this shift challenging.
I think there are some ways you can structure the Medicaid waivers so that they have more flexibility. It feels like we're at a bottleneck, and we talked about this, and I think that's one of the points Colin was getting at, where we have this challenge in the Medicaid program in Maine, and just in this session, I think about 9 or 10 million were cut from the intellectual disability services to go towards that deficit. I understand that's a difficult situation, but as resources are being ratcheted down and we have this pressure building up on the waiting list, we really could use some modest relief, maybe, and I hate to say it in these times, but new allocations to try and get that moving, and so that we can use the resources that are there, like the families and individuals can be supported the way they need to be in the community. So.
Yeah. Well, thank you all for coming in. We're about at the end of our time, but I think it's an incredibly important topic, and all of your perspectives, I think, are very helpful. Be helpful to the viewership.
Thank you.
Thank you all. Thanks for staying with us. We'll be right back.
Do you take the stairs, skip dessert, do laughter yoga? Could what you do work for someone else? If we could all exchange ideas about what we do to be as well as we can be, then would life be better for us all? That's the idea behind Well Then. It's an online community where people come together to talk about many ways to be well. It's made up of people in all stages of life and health that come together online to exchange ideas about well-being. Whether it's talking about exercise, spending time with family, healthy eating, ways to give back, or living with a specific medical condition, Well Then touches on all aspects of personal, family, and community health. Each week, a new topic is featured as a conversation starter. The online community takes it from there, sharing ideas, writing posts and comments, adding pictures and video. Well Then users can also connect on Facebook, Twitter, and YouTube. Well Then is sponsored by Harvard Pilgrim, so that there's a place where everyone can all share, learn, and inspire one another with ways to be well. Learn more and visit www.wellthen.org to get inspired, be inspiring, and share your way to be well.
At Martins Point Healthcare, we have 9 convenient locations in Maine and New Hampshire, and the services you need to stay healthy. At our state-of-the-art Portland Healthcare Center, you can see doctors specializing in internal medicine, family practice, pediatrics, and more, plus on-site radiology, lab, and pharmacy. It's one-stop shopping at its best, because we know your life is busy. We also have 6 other offices throughout southern Maine, as well as offices in Bangor and Portsmouth, New Hampshire. Our doctors are all board certified, and our practices are consistently rated highly for quality and service. In addition, we offer several specialized health plans. To learn more about both our healthcare centers and health plans, visit us online at martinspoint.org. Finding a doctor is the first step, but at Martins Point, we believe in supporting our patients so they can learn how to take care of themselves every day to live the healthiest life possible. At our Health Education Center, conveniently located right next door to our Portland Healthcare Center, we'll work with you to achieve optimum health. Whether it means eating healthier, quitting smoking, or managing a chronic condition like diabetes or heart disease. As a not-for-profit healthcare organization, Martins Point is focused on one thing and one thing only: providing the best care and the best healthcare experience to our patients and members. We hope you will trust us with your care. Visit us online at www.martinspoint.org for more information.
I'm a father and a grandfather. I've been a pediatrician for 27 years. You watch a kid grow up, and now that kid is a mom. We get to do the baby visits all over again. And don't forget yourself. We need you healthy too. Just because you have kids doesn't mean you stop being my kid. Anthem, Blue Cross, and Blue Shield.
Now, our perspective. Well, you've just heard a conversation today about a very vulnerable population in our society. These are folks with developmental and intellectual disabilities. And personally, I find it frustrating that we have a waiting list of near 1,000 people waiting for services through our Maine Care program. These are the folks who truly need the services more than any of the rest of us in our community. Having said that, there's been a shift over a period of years, and you heard some discussion about sort of how care was given many years ago through more of an institutional setting. And there's been much more focus on integrating folks with disabilities into the communities and supporting them as much as possible through natural forces, families, communities, and jobs. And then picking up the pieces and adding the support where it's necessary. What's interesting is that many of these organizations that serve these folks have funds coming to them through the Medicaid system or through the federal government. And oftentimes there are many strings attached to those funds, and flexibility is not always available. And it's going to take a recognition from people at the policy level that we need to allow flexibility and innovation in order for these organizations to find more cost-effective ways and effective ways to care for this population. That's our perspective. The mission of Inside Maine Healthcare is to create a more affordable, sustainable, and results-driven healthcare system here in Maine. We do that by bringing different thought leaders together, discussing issues of the day, and really trying to put an eye toward solving long-term healthcare cost problems here in the state. Inside Maine Healthcare is made possible by the generous support of our sponsors and our advertisers. To learn more about becoming an advertiser or sponsor, please visit us at www.mainevod.com. Next time on Inside Maine Healthcare. Coming up, we have Rock Rodrigue and Kathy Berry from Advantage Freedom, Inc.
Let's face it, Medicare plans can be complicated. That's why when someone finally gets it, it makes my day. When I hear that relief in their voice, I know I've done my job. I'm Samantha, and I'm proud to work for Martins Point Generations Advantage, the highest-rated Medicare Advantage plans in Maine for the last 2 years, according to Medicare.
More people joined a Martins Point Medicare plan than any other in the state last year. We've provided high-quality health care here in Maine for nearly 30 years. It's your health. That's the point. Martins Point.
Inside Maine Healthcare is Maine's only show dedicated to healthcare in Maine, brought to you by the healthcare industry and business leaders. Inside Maine Healthcare will bring you the practical information you need to understand what is driving our healthcare costs and identify the resources available for you to better manage your own healthcare. Learn how healthcare reform, new laws, and policymakers impact Maine business and consumers. Find out what business can do to offer affordable, comprehensive healthcare. Join us as we discover and implement innovative solutions to Maine's complex healthcare challenges to provide Maine people more affordable, sustainable, results-driven healthcare.